Welcome to Natra Farm.
Magandang araw!
Welcome to Natra Farm.
Here in Natra Farm, we believe the real difference is made by people. And I am honored to be a part of this team of loyal and dedicated professionals with unwavering commitment to improve healthcare through quality products, sincere service, and a reliable partnership. Welcome to Natra Farm.
Oh, we have a guest. Good morning.
Good morning po.
Maayong aga sa imo.
Hello po!
Hi po.
Hello po!
Maya paabak.
Magandang araw po!
Maupay na aga.
Our people are the Natra Farm advantage. You and your patients are at the heart of what we do.
Good evening, everyone. Good evening, everyone. I'm Dr. Cindy Canceko Llego, and I'm your host for today. To start our program, I would like to invite everyone to pause, reflect, and join us in prayer as we show our invocation to be followed by the national anthem and the Philippine Pediatric Society hymn.
Mga kababayan, ang pambansang awit ng Pilipinas.
Good evening again to all our attendees for this webinar. To start our program, let me now welcome the President of the Philippine Pediatric Society, North Central Mindanao Chapter, Dr. Amelita Maria Hamoy.
Thank you, Sins. A pleasant evening, colleagues, guests, and friends. Welcome to the first virtual lecture of the PPS North Central Mindanao, entitled Complementary and Toddler Feeding by our pediatric gastroenterologist, Dr. John Paul Oliveros. This topic is in line with our Nutrition Month. This is just a beginning, an introduction and a start of lecture offerings by our Committee on CPD. We hope to give you lectures relevant and useful to your practice. We will try to achieve these goals in the coming years. To our committee chairwoman, Dr. Maria Therese Habay, her members, Drs. Jao Oliveros, Eli Sanchez, Michael Te, congratulations in advance. Thank you to our friend from the pharmaceuticals, the Natra Farm, for the technical support, and may they continue to be our partner in the near future. Lastly, to our members, guests, and friends, thank you for joining us and for your support. Sit back and relax. Hope you will enjoy tonight's lecture. We will appreciate your feedback and comments to make our succeeding lectures fruitful and engaging. Again, good evening. Keep safe, everyone.
Thank you, Dr. Baby Hamoy, our newly inducted president of the chapter. As Dr. Baby mentioned, this is an ongoing project of the chapter that seeks to provide CPD units to our members and those who may be interested, even if they're not part of the chapter. So I'm very excited to announce that we have more than 100 attendees for our webinar right now, which is more than what we usually get during our face-to-face lectures in the past. So we have to be very thankful about this virtual platform for bringing all of us together. So at this point, I would like to share with you some house rules. So first, we'd like to remind everyone to please stay until the end of the program to access the CPD quiz and to get your certificate. During the lecture and open forum, you may type your questions in the Q&A box, which you can find on your Zoom panel near the bottom. For questions about getting your CPD certificate, in case you don't get it at the end of this webinar, email us at ppsncm.cpd2020@gmail.com. So now it's time to introduce our speaker for today. Dr. Oliveros is a graduate of Xavier University College of Medicine. He did his pediatric residency training at Riverside Medical Center in Bacolod and his fellowship training in gastroenterology, hepatology, and nutrition at the University of the Philippines, Philippine General Hospital. He is currently an associate professor at the Xavier University Jose Rizal School of Medicine, a pediatric GI consultant at the Northern Mindanao Medical Center, and he's also affiliated with Maria Reina Xavier University Hospital. He's also an active consultant in all of the hospitals in Cagayan de Oro, even including Amay Pakpak Medical Center in Marawi. So he holds his clinic at Maria Reina Xavier University Hospital. So friends, without further ado, let's welcome Dr. John Paul L. Oliveros to talk about a topic that's very important to all pediatricians. It's on complementary and toddler feeding.
Hello, everyone. So I hope you can see me. I have like 4 spotlights in front of me. All right, wait, here. Okay, okay. So I'm missing all of you guys because I'm used to go to your respective cities and lecture on certain GI topics, but because of our COVID crisis today, so we're left at having lectures online. So I'm sure that you're all already have your fair share of online lectures, and I hope you you still find interest, in this topic, nutrition topic, pediatric nutrition topic, that is not really talk about that much, but for me, it's quite important. So you will see later on why it is that important. So I would like to, before I start, I would just like to thank the chapter, for inviting me to share on complementary and toddler feeding, especially the CPD committee, of which I'm part of. Okay, so the golden window of opportunity for us to be able to intervene by giving nutrition and other interventions in order to have a positive impact on the child's physical and mental development is in the first 1,000 days of life. So this is the time frame from the conception, or in the embryo is formed, time of birth, and up to 2 years of age. And according to UNICEF, the first 2 years of life is the most sensitive period in the child's development. And of the first 1,000 days, your complementary and toddler feeding makes up almost half of the first 1,000 days. So traditionally, we define complementary feeding as the introduction or the adding of solid foods to milk, be it be breast milk or infant formula. But the World Health Organization has a new definition of complementary feeding, and it defines complementary as the giving of solids and or infant formula in supplement to your breast milk. So this evening, we'll just be talking about complementary feeding more on the traditional definition. So complementary feeding needs to happen because of nutritional and developmental reasons. We need to fill the nutritional gap during the time when breast milk is no longer sufficient for physical growth of the infant. It is also important that the infant is able to transition from milk to table food. And it is during complementary feeding the child trains on appropriate feeding skills necessary for healthy eating habits later on in life. And a lot of feeding problems in childhood take root from poor complementary feeding practices. So as the infant grows older, the energy requirement in terms of calories per day also increases. And by 6 months of age, the calories provided by breast milk will no longer be enough to meet the increasing energy needs of our growing infant. And not only in terms of calories, birth stores of certain micronutrients like iron and vitamin A will also be depleted when the child reaches 6 months of age. And their amount in breast milk will no longer be enough to meet again the requirements of this growing child. Thus, we have to give other nutrient sources other than breast milk. So you see here that it is in the first 1,000 days that most of brain growth occurs. And the rate of brain growth parallels that of linear growth of the child, also occurring in the first 2 years of life. And the brain not only increases in size, but also increases in activity, as demonstrated in the first graph by glucose uptake and oxygen consumption of the brain during the first 2 years of life. And there's also a lot of synaptic growth, myelination, and pruning occurring also at the same time. So these are all orchestrated processes, almost all of them dependent on specific type and amount of nutrients. So take, for example, iron deficiency. There are a lot of iron-dependent changes in brain architecture during development. And it depends on individual genes and protein profiling. And when you have iron deficiency, you will be able to affect neurochemistry, neuroanatomy, and neurometabolism occurring in these infants. And this will result to consequences on their behavior later on in life. So you see here the relationship between deficiencies, nutrient deficiencies, and resulting not only to problems in brain development, but even resulting to behavioral problems later on in life. So they say that complementary feeding is a sensitive period for learning new tastes, preferences, and also establishing healthier dietary behaviors. And this study demonstrates that complementary feeding patterns that encourage food acceptance and discourages innate preference for sweets results to healthier eating preferences later in life. However, there are some conflicting studies. Some studies, like for example, this one saying that there's no correlation of complementary feeding practices with early eating behavior and what we call as food neophobia, or the fear of new tastes. So there's still room for more studies. So tonight we'll be talking about complementary feeding, and most of my my references comes from the WHO guidelines on complementary feeding in the breastfed and non-breastfed infants, and we'll also see some of the newer guidelines, and recommendations brought about by the European Society for Gastrohepatology and Nutrition. So I've already discussed why complementary feeding is important, and the next slides will be on the when, the hows, and the whats of complementary feeding. So the introduction of anything else other than breast milk should be at 6 months, according to World Health Organization. And breastfeeding should still be continued even if we introduce other food until 2 years and beyond. And that's according to the World Health Organization. But FPPS has other recommendations. They recommend that we start before the infant reaches the age of 6 months, and we can even start as early as 4 months, for several reasons. So complementary feeding, the timing really varies depending on social and cultural factors, and also the factors found in the developmental readiness of the child, if whether or not their gastrointestinal tract, their kidneys, and their neurodevelopmental abilities will allow them to start complementary feeding. And it also depends on specific nutritional requirements for the individual infants. And also, it's important to consider health effects on the timing of complementary feeding. And we'll be discussing some of those health effects later on. So when will be an infant ready for complementary feeding? So the American Academy of Pediatrics give us some clues that should be present in that infant before we can start complementary feeding. Like, for example, the infant must have the ability to sit without support and has to have good head and neck control. And the infant can already munch or chew and use the tongue to move food, pureed food, to the back of the mouth for swallowing. And there's also the absence of the extrusion reflex at the time. And we have also to observe if the infant can already bring his or her hands to the mouth, for exploration. And already complementary feeding ready infant, usually indicates desire for food, especially during mealtime of the family. So if you have all those, probably your infant is already ready for complementary feeding. So responsive feeding is the recommended method by most experts, on how to do complementary feeding. And it is when there is reciprocity, between the child and the caregiver. So the caregiver feeds the infant, directly, and assists older children while they feed themselves, while being sensitive to their hunger and satiety cues. So parents are supposed to feed slowly and patiently, and should be encouraging and not forceful. So this should be the time, that the infant, is given different food combination, taste, textures, and also for the parent to try different methods of encouragement. And it is advised, that when we do complementary feeding, we limit distractions during meal times, and then we encourage the parents to talk to their children, have eye-to-eye contact, and try to see, if some foods are not readily accepted, and if there are certain foods that are not accepted during the first try, you have to tell the parents to try at least 3 to 5 times, before giving up on that food. And hopefully in the next feeding or the following day, we could again try that food. What I usually tell the parents, to make sure that the child, has not been fed anything for 2 hours before meal times, di ba? Kaya kung gutom ang child, they'll eat anything. So the opportunity to introduce new food taste, is there, when the child is hungry. And reciprocity between the caregiver and infant depends on a lot of factors. So we have maternal factors like parenting style, also the family characteristics are also important factors, and factors present in the child, like depends really on the child, their appetite, their innate taste preferences, and also the growth stages of the child. All of these are factors, that play an important role on the success of responsive feeding in the child. So it's also important to emphasize the practice of good hygiene and proper food handling. So we have to remind the caregivers to wash their hands and the child's hands, before food preparation and eating. And storage is also important. Food must be safely stored and also safely served. And the use of clean utensils to prepare and to serve food must be there. They have to use clean cups and bowls when feeding children. And it's also important to emphasize to avoid the use of feeding bottles, which are quite difficult to clean. And this is important because we have to prevent transmission of foodborne illnesses, which sometimes lead to morbidity and death to our infants. So when we start complementary feeding, we start by giving small amounts of food, and gradually we increase that quantity, as the child grows older. So you see here at around 6 to 8 months, the child, when we start complementary feeding, will just be able to take in around 2 to 3 tablespoons of that food, and gradually we increase during that time until half a cup, or around 120 ml. And around 9 to 11 months, the child will be able to consume half cup, and at more than 1 year of age, the child may be able to consume up to 1 cup of food. How about food consistency? So we have to adapt to the infant's requirements and abilities as we progress our complementary feeding. And we start usually with pureed or mashed or semi-solid foods, which can be tolerated by these younger infants. And when the child reaches around 8 months, we can try giving finger foods, or these are foods that the child can hold by himself, and while he feeds himself. And at 1 year of age, the child must be able to eat table food, or the food that's being served and eaten by the family. And even when we start with solid feeding, it's important that we avoid giving food that may cause choking. Food, the size is small enough to go inside your trachea, like for example, like corn kernels, and popcorn. Sometimes they may get stuck in the trachea, and cause choking. Also like nuts and grapes and raw carrots. So texture is important, So usually at 6 to 8 months, we start with porridge or well mashed foods, And at around 9 months, we can start giving finely chopped or mashed foods that the baby can pick up. And at 1 year age, table food. So it's also important to increase the number of times that we feed the child, starting from around 2 to 3 times a day at 6 months, and gradually increasing the frequency as the child grows older. And when the child reaches around 1 year of age, there's supposed to be at least like 3 meals and 2 snacks per day. And the number of meals really depends on the needs of the child. So it's important to consider the energy gap as the child grows older. And the amount we can estimate to be around 30 ml per kilogram body weight. And it's also recommended that we give food that's more dense than breast milk. That's supposed to be more than 0.8 kilocalories per gram. And you see here, 2 to 3 meals per day at 6 months, then going around 3 to 4 meals per day, when the child reaches 1 year old, 1 year of age. So a variety of foods are also needed to ensure that all nutrient needs are met. So meat, poultry, fish, or eggs can be given daily or as often as possible. And it's important to know that the food that we're giving should provide not only sufficient energy, but also will provide for the protein and micronutrient requirements of the child. So you see here, there are already nutrient gaps, not only in energy, but also protein. See here, iron and vitamin A when the child reaches 1 year old. So variety, so they say that you're giving good variety of food when there's around 4, when you give around 4 of the food groups per day. So we have 7 food groups in all. So at least you give 4 in a day, or at least you complete the 7 food groups. You're able to give the 7 food groups in a week. So that's more or less good variety, because you cannot find all the nutrients in one food. That is why I'm not really a fan of giving what do you call that, commercial food to infants. And we have to give food that's rich in energy, protein, micronutrients. No? The food must not be spicy or salty, and it must be easy for the child to eat. And of course, preference, no, taste preference is a factor for children. And this food must be locally available or affordable kay murot ang kwarta sa parents no kung sige palit o imported food. So food and from animals or fish are good sources of protein, iron, and zinc. Your dairy products like your milk, cheese, yogurt are good sources of calcium, protein, energy, and B vitamins. Your pulses like your beans, peas, peanuts, soybeans are good sources of, again, proteins and also give you some iron. And when you eat tomato, citrus, and other fruits containing vitamin C, it's important. Green leafy vegetable can also give you vitamin C and also helps in iron absorption. And orange colored fruits like your carrots, pumpkin, papaya, and your dark green leafy vegetables like your spinach are rich in beta carotene and also contains vitamin C. And giving fats and certain healthy fats and oils at this time, your fats are a good source of energy. It's the most energy dense of your macronutrients. The problem with vegetarian diets, I get a lot of parents giving only vegetables to their child until the child reaches 1 year old. This is quite lacking in a lot of micronutrients and calories. So we have to educate our parents. It's important to give a variety of food at this time. And it's also wise to avoid giving drinks with low nutritional value like your coffee, tea, and your soft drinks. And limit the amount of fruit juices to be given to the child because your fruit juices will make your child full and will so the infant will not be able to consume a lot of healthier food options. Okay. So your fortified or complementary foods or your vitamin mineral supplements may be given to children on complementary feeding because it's not immediately that they'll be able to eat a lot of foods. So they're prone to micronutrient deficiency. And it's also recommended that we supplement the mothers, especially the breastfeeding mothers, because a lot of them will not have a healthy diet, and their breast milk might. So the value, the amount of micronutrients present in their breast milk really varies depending on the diet of the mother. So it's wise to advise the mother to take in vitamin supplements or mineral supplements if they think that their diet is not that healthy. And during illnesses, so we advise to give more fluids to the child than the usual. And once the child gets, when the child recovers from the illness and the appetite returns, it's also important to give more food than usual so that the child can recover from the lost nutrients that occurred during his sickness. So a mnemonic that you can use is FATVA. So when we think about complementary feeding, so frequency, so it depends really on the child's age. So start with 2 to 3 feedings per day and until you reach around 4 to 5 feedings. So that's 3 meals and 2 snacks by 1 year of age. And the amount usually start with 2 to 3 tablespoons, and then later on, at 8 months, the child may be able to consume half a cup to 1 cup. at the age of 1. And texture start with pureed or mashed food. Then later on, finger foods at 8 months and table food when the child reaches 1 year old. And 4 out of the 7 food groups when we talk about variety. And the method of feeding that's advised is really responsive feeding, which means that the caregiver should be able to respond to the child's feeding and satiety cues. And it's also important that we prepare the food hygienic, that we prepare the food to be safe. Okay. So there are certain issues with regards to complementary feeding. So its relationship with allergy and its relationship also with adult diseases like your diabetes and cardiovascular diseases. And later on, we'll talk about some other alternative complementary feeding methods. So with regards to allergies, they say that the incidence of allergies is increasing yearly, especially in the first world countries. And this occurs despite a lot of restrictions in the diet of the infant and even the mother. And so there's a question if complementary feeding is related to immune tolerance, and if there are other factors aside with the timing of complementary feeding and the type of complementary food that we give. Are there other factors, like for example breastfeeding, playing a role in prevention of allergies? So let's try to see. So the experts would say that the ages of 4 to 6 months is a critical window, because they say if you introduce food earlier than 4 months, there's an increased risk for allergy. And some studies also showing that if we delay the introduction of certain foods, especially the allergenic foods, actually you don't prevent allergy, but actually you may increase the risk of allergy by doing so. So this study recommends that if we start complementary feeding at 4 to 6 months, we lower the risk of food allergy. It's around 17 weeks, or going 5 months actually. And we have to introduce complementary feeding before the child reaches 6 months. But this is not really for allergic reasons, or atopic reasons, but mostly for nutritional reasons. So there's no benefit really on delaying the introduction of complementary feeding later than 6 months. And several studies showing that if you continue giving breast milk, even when you start complementary feeding, you actually prevent or reduce certain atopic diseases. And again, another study showing that complementary feeding at 4 months is important to prevent allergies, and actually no evidence in delaying the introduction of allergenic food. One good example actually is Israel. So, diba, they have a lot of food that's peanut based. Okay, so they did a lot of studies, and they've seen with the studies that even if you introduce what you call that, yung peanut paste early during complementary feeding, it doesn't lead really to allergies and even peanut allergies, which is quite common. We have our own local guidelines actually from PSI and from my society, PPS-PGHAN. And again, saying that it's important to continue breastfeeding up to 6 months and not to delay starting complementary feeding, not later on than 6 months. And you see here, the delayed introduction of certain food like your eggs, wheat, fish, and peanut, really doesn't have any clinical significance. So what I do personally, when I talk on complementary feeding, about complementary feeding to my patients, I tell them to start with ginaling na bugas, or lugaw, for a week. Then later on, introduce new food. So depende what food is usually available to them. I usually tell them to start with fish, and then give fish with your lugaw. Then you can also use the blender, to make a puree out of fish and lugaw, and then give this food, for the next 3 days. And if there are no signs of allergies, or no rashes, no vomiting, or hematochezia or hematemesis, so that's pretty good evidence that the infant is able to tolerate fish. Then after that, they can introduce other food, so every 3 days, in order to see if the child develops food allergies, because we really do not have any idea of what type of food allergy the child is going to have. So it's really more of a trial and error method. How about adult diseases? So there's no correlation between the timing of introduction of complementary feeding with development of risk for these adult diseases like your obesity, diabetes, and cardiovascular diseases in adulthood. But if you give excessive protein, especially giving a lot of milk, meat, or cheese during complementary feeding, more than 15% of your total calories, it is associated with risk of developing obesity later on in life. And also, they found out that if you give a low-fat food, or low-fat complementary feeding, you also develop obesity later on in life. So kind of ironic, na giving low-fat during complementary feeding leads to obesity later on in life. And also, consumption of sweetened beverages like your fruit juices before the age of 1 actually increases the chance of obesity in childhood. And that's why the American Academy of Pediatrics recommends that we do not give fruit juices in less than 6 months, and we limit only to less than 6 ounces for infants 6 months to 1 year old. So they should be only given less than 6 ounces. And we don't really advise adding salt to our complementary food, because if we add a lot of salt, it increases the risk of hypertension later on in life. And also some studies showing that giving fish, we give a lot of your long chain polyunsaturated fatty acids, and actually this has some benefits, especially on lowering lower blood pressures during adulthood. So how about some other feeding methods, other than your responsive feeding method? So in the Western countries, some parents use your baby-led weaning and auto-weaning. So baby-led weaning is a method wherein infants are given food that they're able to hold, and the parents just leave the infant to eat by themselves. And auto-weaning is when the table food of the family, or what's served in their table, they just chop and mince it. So if they're like serving spam, so they just mince the spam and just give it to the infant, and then the infant is left to feed him or herself. Okay, so actually not a lot of studies comparing the different complementary feeding methods. No? But it's still advised if if the parent opts to use these methods, no, to still start at 6 months of age, and if possible, to continue breastfeeding while they start their different complementary feeding methods. Okay. They say the advantages if when we use the baby-led weaning or the auto weaning, no, is that it improves relationships, you know, during shared family meals because they're eating the same type of food, and also promotes some autonomy for the infant, and saves a lot of time and money for the parents, you know, because they don't really have to put a lot of effort in making their complementary food. So they just chop, you know, or give the food directly to the infant. You know? But there are some concerns with these alternative complementary feeding methods. One is that a lot of micronutrients, you know, and even macronutrients, you know, calories may not be enough, you know, with these infants on the alternative complementary feeding methods. You know? And also the risk of high salt intake because adults, you know, usually have salty food, and when you give it to the infants, no, it's not really good for these kids. And also the risk of choking is there, you know? So because diba, if you give yung mga solid foods, no, this may not be tolerated well by younger infants. Okay lang kung going 1 year old, no, but for younger infants, no, so there's the potential risk of choking. So actually, there's no decahon method, no, when we talk about complementary feeding. So it depends, no, on what type of method that the parents would want to use on their child, no, but they have to consider factors like the risk of infection, allergy risk, and also the neurodevelopmental capacity of their child, no, and also the availability of certain of the food that they want to give. So to optimize complementary feeding, no, as a review, it's advised to start not before 4 months, but not later than 6 months of age. And when we start complementary feeding, we have to continue giving milk, especially breast milk if the baby is breastfed. And it's important to give food that are rich in energy and micronutrients, and also to give the appropriate proportion, no, of nutrients, no, or food types, and also the appropriate variety of food and the recommended frequency of feeding. And responsive feeding is what is usually advised, no, and also really emphasize on the safety in preparing and in the giving of food, and also in the storage of food. So there, if you take a look at the website of PSPGHAN, you can download there the a pamphlet, no, on complementary feeding. So actually, it's very useful, no, and it's what I give the parents, no, when I talk about complementary feeding. So when the child reaches the age of 1, no, obviously their requirements for energy, no, and a lot of macro and micronutrients also increases, no, and the acceptable macronutrient distribution range also will be different, no, from as compared to those younger than 1 year old. So you see here that as the child grows older, no, as the child reaches 1 year old, no, your total amount of fat in the diet actually decreases, no, and during toddler, the toddler stage, no, fat should be only around 25 to 35% of the total amount of energy being given. Okay, so these are all seen in your Philippine Dietary Reference Intake. So actually, not really clinically useful, no? And if you use that to educate our parents, so they will not be able to understand. You see here, ano, no, that we recommend to give less free sugars or table sugars, no? Commonly seen in fruit juices and soft drinks. And also limit sodium intake and try to increase potassium intake. So for toddlers, no, they'll be able to consume around 3 to 4 meals per day and around 1 to 2 snacks per day. So that's around 1 cup per meal. But for parents, no, very difficult to show them numbers. So I make use of the food guide pyramid. No, you can also download this in the PSPGHAN website, and you have there a meal plan, no, for 6 months and to 1 year old, and for 1 to 3 years old. No, so complementary feeding and toddler feeding. No, so you can use this as a guide for your parents who wants to start complementary and toddler feeding. I also make use of your Pinggang Pinoy. So you can download this also for free in the FNRI and DOH website. Actually, this is a good illustration for the parents, to be able to understand that we have to give the right amount, or proportions of go, grow, and glow food. So dili pwede na puro lang rice or puro lang protein, no? Or puro lang gulay. So dapat may variety, no? And also in the right proportions. Actually, if you can also download from the website meal plans, no? For Pinggang Pinoy. But the meal plans that you have there are actually for older kids, 3 years old and above. So what's happening in the Philippines? So let's review our complementary feeding situation. No? So you see here, around 90% of Filipinos Filipino infants, are actually given at least 2 meals, per day at the age of 6 months. So that's kind of good grade, no? But when we talk about diversity, only 60% of infants on complementary feeding will have more than 4 food groups per day. So needs quite a lot of improvement. So frequency more than actually 80% pala ang frequency reaching at least 2 to 3 times a day. And 90% of them, of our infants, are already started on complementary feeding by 6 months of age. The problem is your minimum acceptable diet. So your minimum acceptable diet takes into consideration the diversity and the frequency. So only less than half of Filipino infants actually have a diet that is both diverse and also have the recommended frequency per age. So that is why you see here this data from your FNRI that actually this is for 2011 to 2015. So much more recent data. And when we talk about the diversity, less than 30% actually of infants nowadays have a diet that's diverse, more than 4 food groups per day. And frequency, again, still at the 90s. But when we talk about the minimum acceptable diet, which means that the child has both recommended variety and frequency, less than 20% of infants meet the standards. So what actually this results to in wasting, you don't see a lot of wasting in children. Our figures and values on wasting is quite consistent through the years. But you see that effect in stunting. So when the child reaches the age of 2 years old, you'll have around 30% of Filipinos stunted. Actually, we're second to the last in terms of height in Asia. So we're one of the shortest in Asia. And we know that stunting is correlated to the child's IQ later on in life, educational attainment, and productivity, and also is correlated with the child's health when he reaches adulthood. So let's also talk about the FIT study. This is a survey on the type of food that our children are eating. Actually, this survey was done on older kids, 3 years old and above. But you see here that the amount of food in terms of calories is quite low for a lot of children. Although some children would have excess calories, especially when they reach their adolescent stage. The intake of our kids are quite high in carbohydrates, especially that of free sugars, and they have less intake of fat and protein. So you also have deficiency in their intake of certain micronutrients like your zinc and folate, and some of your trace minerals like your calcium. So you see here that these children, ages 3 years old, actually the type of complementary feeding or the complementary feeding that they receive earlier in childhood really affects their food intake when they reach the age of 3. And a lot of these kids also prefer salty food and sweet food in the form of pastries and sweetened beverages. So you don't have an ideal eating scenario for our Filipino kids. And it's no surprise really we have a lot of stunted kids because a lot of our infants have a diet that's really deficient in, especially in the type 2 nutrients that could lead to growth delays or growth failure. So before I end, I'd just like to remind everyone that complementary feeding has nutritional, developmental, and behavioral importance, and the timing, the method of feeding, frequency, amount, and variety needs to be proper. And if you have poor complementary feeding practices, this leads to a lot of consequences in health, in the child's behavior, and also economic consequences, leading to problems in our nation building. So as pediatricians, aside from recommending breastfeeding, we have to also educate our parents on the proper way of giving complementary food so that we have a better future for our kids. So with that, I end with this quote. So you are what you eat. So what would you like to be? So thank you for your attention.
Thank you very much, Dr. John Paul L. Oliveros, for that comprehensive and very informative lecture on complementary and toddler feeding. Indeed, it was a very fruitful lecture in terms of things that we learned. I especially like the part on its association with allergies and also adult diseases, and also the practical tips that we can impart to our parents when they ask us about complementary feeding. So at this point, I again would like to remind the attendees that you can put your questions in the Q&A box located at the bottom panel of your Zoom screen. So for now, I do have some questions in the box, and I'd like to field these questions now to our speaker. So the first question is, how do we encourage a child to drink water? For a child who prefers milk all the time instead of drinking water.
Okay. So actually, before the child reaches 1 year of age, we can give some amounts of water, but we still have to encourage the giving of milk during when we start complementary feeding. But when the child reaches the age of 1 year old, this is the time when milk is supposed to be the giving of milk should be decreased. Hopefully the child will be only taking milk once or twice a day na lang. So one method that I usually advise the parents is to do bottle weaning. So instead of giving milk using bottle, we can advise them to use the glass. So actually, there are a lot of apprehensions when I tell them this, because they say na kaya na ba niya, Doc, or sana. When I tell them na actually we do cup feeding for our preterms, so there's no reason that the child will not be able to drink milk from the glass. So when you give milk by the glass, it's kind of parang hassle na for the child. So their intake of milk tends to decrease na. And this is the time wherein you can introduce more food, and also instead of giving milk, you can also give water na lang instead, so that the child will be able to also reach the desired amount of fluids or water intake. So that's my tip. Give away the bottles when the child reaches 1 year old. Actually, di ba recommended gani when the child reaches 2 years of age, dapat wala na gina siya bottle feed, because when you still bottle feed your child at the age of 2, you have increased risk for the formation of dental caries later on in life, especially when you give biberon just before sleep time. So that's not recommended actually.
I think the pediatric dentists and the dentists in general would agree with you heartily regarding that, Doc Zhao. And then a slightly related question. Hi, Doc Zhao. What do you think of giving plant-based milk like soy milk or almond milk instead of cow's milk? How early can we give plant-based milk?
So, gusto siguro sa parent na mahimong new age ng iyang anak.
Organic.
Actually, it's more of the preference of the parents siguro. Actually, wala may evidence if there are if it's more beneficial to give organic or plant-based milk, as compared to your full cream milk, as alternatives for breastfeeding. The only use for soy milk actually is for actually before we used to give soy milk for prevention of allergies. For treatment of cosmic allergy pala. But because of cross-reactivity, 40% chance of cross-reaction, a lot of infants given soy milk will still develop cosmic allergy, or symptoms of cosmic allergy. So it really depends. But for me, dapat 1 year old and above. No? Because this is the time na milk is not really the main source of calories. So when the child reaches the age of 1, dapat food na ang main source of calories. And milk is just there for the calcium. So if your organic milk or plant-based milk like soy milk contains the enough calcium, so I guess you can give this as alternative to your full cream milk at the age of 1.
Again, on milk, another question on milk. Can you comment on giving fresh milk to a child? And at what age can we give cow's fresh milk?
Fresh milk. So
Fresh milk.
fresh milk. So pag if you're not able to breastfeed, emphasize na to ha. If you're not able to breastfeed at that time, so you're already giving milk formula. So there's a reason, why they call your infant formula as infant formula, because they meet the standards of your World Health Organization, sa what do you call that, Codex Alimentum, So there's a standard, minimum. There's a minimum requirement for the calories and macro and micronutrients, And even now, it's already a requirement for infant formula to have DHA, HA, wala pa naman sa pre and probiotics, but so you have a standard. So you cannot give milk that doesn't meet the minimum criteria of your Codex Alimentum, before the age of 1. So if you plan to give full cream milk, or your fresh milk, actually you can give it when the child reaches 1 year old, at least 1 year of age.
So beyond 1 year old, you can give whatever kind of milk
Yeah.
that you prefer. Okay. Going back to your comments on water and giving water to children, I have a couple of questions here regarding that. One is, I thought exclusive breastfed infants don't need water until food is introduced, while those who are not exclusively breastfed should be given water. Can you comment on that, Dr. Zhao?
Okay, so of course, exclusive breast milk, and breastfeeding until the age of 6 months, because we do not want to take the space, of breast milk in our infant's tummy, So if you give food or water, in these infants less than 6 months, you may not expect them to grow well, because of deficiencies, both calories and other nutrients. So 6 months and above, so actually we can give water, but we have to make sure that the child continues receiving breast milk during complementary feeding. So you can give water siguro after each meal, para pangtulak, but still it must not exceed that of your breast milk or your milk formula, until the child reaches around 1 year old, because milk is still an important source of not only for calories but for a lot of nutrients. It's not really sufficient lang yun ang milk, but it's better than giving water, because water you do not have calories there, you do not have nutrients there, only water. So you may not optimize growth in these infants if you give a lot of water. So water in small amounts lang siguro. But when the child reaches 1 year old, no problem. You can because you've already you have to try to cut down the intake of milk, so you can increase the intake of water instead.
Okay, so I guess that also answers the next question, which I would have fielded, which says, parents often ask when can they start giving water to their infants? So I think you already answered that. So let's now go to another group of questions, this time about vegetables. So what is spinach in Cebuano?
Spinach. Actually, kung mag-grocery ko kay spinach, magyapon ang tawag nila. I don't know if anyone can educate us, no, if there's really a, Bisaya
Term
word
for
for spinach. I
for
don't know.
spinach.
Todo seeds.
Okay. How about, I wouldn't know.
I don't know. Nahanad mo ko kang Popeye, good si Popeye, di ba?
And then another question on vegetables. For infants who keep on eating carrots, squash, and other orange-colored fruits, can you comment on the orange tinge of their palms and soles or carotinemia? Should we just stop giving them carrots and squash?
So for me, you can give your orange or yellow-colored food, vegetables. Siguro mga, not exceeding 2 to 3 times a week lang siguro. Because you have the problem of carotinemia, if you give carrots every day or squash every day, So actually, wala man sa chay health effects, except siguro if they don't eat other food na, so they're prone to nutrient deficiencies, excess ilang beta-carotene but deficient ang ilang other nutrients, So, and then a lot of these patients, a lot of these kids, on carrot diet lang or squash diet, will have carotinemia, they'll become jaundice, and they'll be referred to me, even if they don't have liver problems.
I actually have an answer for what is spinach in Cebuano. It's kudyapa from Dr. Matus. Thank you, Dr. Matus.
Oh, sa todo?
Kudyapa.
Kudyapa, okay. Thank you, Dr. Matos.
Another question. What is the earliest age to start multivitamins in an infant? Is it advisable to give it as early as 1 or 2 months?
If you ask WHO, you're not supposed to give anything other than breast milk, because it's in the assumption that mothers, breastfeed, their breast milk is already complete, in terms of calories and macronutrients. But some experts would say na, it really depends, on the diet of the mother, the amount of nutrients, calories not that much, but mga micronutrients, depends on the diet of the mother, if they're taking in healthy diet. Kung healthy ang diet sa mother, so no problem, no need to give multivitamins. But if the mother doesn't really have that healthy of a diet, so I guess there's no harm in giving multivitamins early in life if needed, especially if you have an infant that has signs and symptoms of micronutrient deficiency, or poor growth, or failure to thrive. So you can give early.
Well, I often hear parents also becoming concerned. On the flip side of giving vitamins, they become concerned about the sugar content of the vitamins. Is that really well-founded?
You only give a little amount, Mansat, of your multivitamins, 0.3 ml, 0.6 ml. I don't think na it really increases the sugar, or it affects the carbohydrate or sugar intake, of the child. Unless you're taking a lot of vitamins.
More than the recommended amount.
If you follow the recommended dose, for the age, I don't think that hyperglycemia will be a problem.
Another question on supplements. What is the advantage of premium milk formula compared to low-end formula? And then, would you recommend probiotics? And also, is Heraclin a really good adjunct for nutritional buildup?
Wala ko ka-mention ng Debenclocide ganina, but I'm reserving that for another lecture siguro later on, no? On feeding difficulties. Okay, with regards to the first question
On
on
premium milk versus
premium
low-end formula, is there really a difference?
Okay, so most premium formulas, I think all premium formulas have more whey than casein. So ang mga econo formulas nimo, they're mostly casein. Some studies would say that if you take in milk with a lot of casein, you're at risk for tummy discomfort, no? So a lot of GI discomforts daw. But actually, ang mga studies not that what do you call that? Robust ang data nila, ang claims. That's why and they say that giving whey milk, no, a milk that's having more whey than casein would cause little tummy problems. The problem is lang sa when you give whey milk, they say it has you put the child at risk daw for allergies kung whey man sa dieta. So pili ka lang kung tummy discomfort or allergies. Pero actually for me, no, so again, emphasize again on breastfeeding, no. If you cannot give breast milk, no, so if you're gonna choose between your econo and your premium milk, it depends on your budget actually. So pag dagang ka budget, no, so actually, di ba, premium cost a lot. Premium milk costs a lot. Even for your econo milk, no, so depends on the economic status of the parents. So katong mga DHA, ARA, actually requirement na siya for all milk formula. Some premium milk formula have prebiotics. I think all premium formulas na parang standard na siya na may prebiotics, and a lot of them already have probiotics, no? So actually, it's the milk companies trying to imitate breast milk, no? So syempre, breast milk is a complex solution, a lot of substances and even microorganisms, no, present in breast milk that the milk companies are trying to what they call that, imitate, no? So I think the more the merrier. So but when we talk about studies, well, they have some studies to show, no, benefit in giving milk with prebiotics and probiotics. But again, it still boils down to the budget of the parents.
Can you comment on parents often thinking that if the child is not eating enough, they will just give the child milk in place of solid food?
Again, sorry.
There are a lot of parents who think that when the child is not eating enough, then they will just give milk.
More often, the case is kulang sa pasensya ang parent, no? So and sometimes education din, no? So sometimes when that's why when the child is supposed to be taking in food na, no, 6 months, starting 4 to 6 months, actually it's more of the perception of the parents that the child is not eating well or enough, no?
Yeah.
So you have to really educate them, no? So the amount that the child can take in as food, no, depends on the age of the child, and it's usually way below their expectation because they expect their infants and toddlers to be eating one whole plate, no? So and then the problem is they give milk, no? So we get a lot of obese patients na hinoon, no? Again, these patients are referred to me, no? So that's one problem I see, no? So it's important to really take note on the amount of food that the child really is eating. So if what I do, I refer them to a dietitian. So the dietitian can do 24-hour diet recall. So they'll be able to estimate the amount of calories, no, that the child is taking in as food. So you have an idea kung more or less doon lang siya sa recommendation sa Philippine Dietary Reference Intake for age. So no need for extra milk. But if kung baba gid siya and then you also have poor weight gain and signs of malnutrition, so well, milk you can make use of your oral nutritional supplement, no, when the child reaches 1 year old. So you know naman mga high calorie milk with high calories, di ba? 30 calories per ounce. So I mean, not name brands na lang, pero I'm sure you're familiar with those milk. You can use them, but it's more of kanang bandage lang treatment. So you have to really investigate, no, on what the problem is, if there really is a problem, no. So maybe the child is a picky eater uh, or having organic causes, no, of poor feeding. So you have to investigate. So I'll just talk about that when I lecture on feeding difficulties na lang later on.
Okay. So
It's
you will
another
be answering some of these questions like
another topic na sa.
can you comment on giving appetite stimulants? How long can you give appetite stimulants to picky eaters?
Okay, so appetite stimulants. Well, of course, if you think that your child really has poor intake of food, no, be it picky eater or for organic reasons, and you have failure to thrive, no, actually giving of appetite stimulants can be of use, no. But when we talk about evidence, ang lagi evidence is usually is I think debenclocide lang, debenclocide. So ang debenclocide, no, increases your protein uptake of your cells when you give. So it's important to give debenclocide during meal time, no, or during the intake of milk para maximum ang absorption sa protein. And when you and another effect of the giving of your debenclocide, no, it increases also your appetite stimulant without the neuro side effects of the other appetite stimulants.
How about if the child is already overweight? Can we stop giving milk to a patient 3-year-old and above who is overweight?
You can still give milk, but siguro the type of milk that you're gonna give is non-fat or low-fat milk because the child still needs milk, because milk is a good source of calcium and also a good source for a lot of other micronutrients. But limit the intake of milk to at least 1 to 2 times a day, above 1 year old. So kung basin the reasons that the child is obese is because the child is taking in a lot of milk, no? So basin more than 3 times a day and then also eating a lot. So you get excess calories now instead.
Okay. How about what type of complementary food would you advise parents who belong to low to no income groups where fish, meat, and even veggies are a luxury? Did the local stats you present include the babies from extremely low income groups?
So that's really a problem, only for the Philippines but for the mga developing countries, no. But if you read, actually you can download your complementary feeding publications, no, from your WHO for free. If you read the publications, no, what they advise are locally available food, no. So it doesn't really have to be expensive. So kung meat siya, no, well, fish actually is a good source naman sad of it's a good protein source and source of zinc sad. So but pwede naman fish alone kung mas cheaper ang fish. But it's best that you once in a while they find money to introduce meat, no? Meat also aside from fish. The problem lang with a lot of kids, no, is that actually the food that they're being given are more of pastries kasi mas cheaper magud ang pandesal, mas cheaper ang pandimunay, no? So ginabusog sila sa pastries, no? And a lot of sweets. That's why they don't get to eat a lot of meat sad, no, and vegetables. But kung problem gid ang budget, well, you can refer them to a dietitian. Hopefully, ang inyong mga government hospitals, they have, actually, NMMC has good, kanang dietary department. They can look for food, no, that's cheaper, no, and but nutrient rich foods.
Okay.
Not necessarily that you have to give spinach to all your kids, no, to have a healthy diet. Pwede ra kalamunggay, kangkong. And kung meat
Whatever
siguro,
is available.
di lang dilata na mga meat kay very salty mo lang dilata na meat. But you can siguro once in a while baka, baboy or manok. And then when you try to take a look at the di ba, pinggang Pinoy, your protein naman the proportion of your protein, no, is or protein source or your grow food, no, it's not really that big, di ba? One matchbox size lang gani ang requirement, di ba?
Yeah. Okay. And then I have some questions here about readiness for complementary feeding. So one is for preterm babies, can we start feeding at 6 months or we wait until the child has head control and able to sit by himself or herself? And I also have a related question for that, like those with cerebral palsy, for example, when you don't really expect that they will acquire head control anytime soon, will you really postpone complementary feeding until they will acquire it?
So there's really no hard fast rule, no, on whether or not we can give or when to give this children solid food. But in my experience, for children who do not have head control or neck control, the risk of choking or aspiration is high. So especially if you have drooling, no, and then it takes a while for them to even consume their milk, no. So sometimes, diba, most of the time they are able to finish milk feeding by around 5 to 10 minutes, no, ako ng 15 minutes. But if it takes long for them, no, more than 30 minutes to even finish their milk, so it's not a good sign that you can start complementary feeding. So what do you do? No? So a lot of these kids will have oropharyngeal dysphagia. Labi ng mga cerebral palsy kids, so they have swallowing problems. So if you give them semi-solid food, some of them will be able to tolerate your semi-solid food, and some of them won't be able to tolerate your semi-solid food. For those who are not able to tolerate their semi-solid food, it's advised to start them on enteral feeding, NGT feeding. So you can give blenderized food.
For them. How about for the preterm babies? Do you wait until they acquire
Preterm,
the food?
Yeah, I think
If there is a little bit of delay.
so medyo mag-delayed sila no sa katong ilahang
Or
ako.
some of them might have gastrointestinal reflux and other feeding difficulties.
Yeah, feeding difficulty. So it depends, no? Kung well lang siya na preterm, usually when they reach 6 months of age, most of them naman said will have head control na. For those who do not have head control, it's kind of red flag, as red flag sign for oropharyngeal dysphagia. So you can tell the parents to do trial and error. So if they try to feed pureed food and then nothing happens, so maybe pwede. Pero if like choking happens, or aspiration happens, or if it takes quite a time, for them to finish feeding, only able to give a little amount of food lang, and then or takes them more than 30 minutes. Sometimes other parents tell me it takes them an hour to feed or 2 hours to feed. So murag attached to kid na ang parents, no? So it's a sign of oropharyngeal dysphagia. So you can refer them to me para ako na lang sa ila, mag-sales talk sa NGT feeding before the child becomes malnourished.
And then just a couple more questions about myths. Okay, there are several other questions here on the Q&A box, but as most of them have been answered already, either during the Q&A or during the lecture itself, I will no longer be saying the questions aloud. So I'll just stick
Call
to
me na lang,
the
Doc.
last.
They have my number
Sorry.
naman. They can text or call me.
You can also text or call Dr. Jao
Para-
Oliveros for your um, questions. So just a couple more questions before we close the open forum. So first, would the type of food the mother is eating while the child is intrauterine have an effect on the child's eventual food preference?
So kind of controversial, although some I'm not really sure ako studies on that, but they say na actually it's more on the breast milk daw. So the type of food that the mother is eating, that some of these chemicals or substances that they eat ends up in their breast milk. So when the child breastfeeds, they will have the same taste preference now
The mother.
to the mother, to what the mother is also eating. So kung ang mom is eating a lot of veggies or bitter herbs siguro, so mas makatolerate daw ang bata sa mga this kind of
Is there
food.
a study about that? Because I have experienced that anecdotally, but
Yeah.
there are studies about that. Yeah.
I think there's some truth to I'm not really sure kung intrauterine. So I guess ang siguro some substances gets its way into the placental circulation siguro, goes to the kid, pero wala pa siguro big study on that. So it's a theory, but again we recommend healthy diet for for pregnant mothers and also for the lactating mothers. They just have to eat balanced diet.
Okay. And lastly, is it true that a child tends to become a picky eater when he is fed mainly with commercialized complementary foods most of the time, like the brands available out there that are quite popular?
Yeah. So for me, when you give commercial food, or commercial infant food, the problem of variety is there, so they tend to receive the same type of food lang, so the preference for that food, the taste for that food is dominant sa infant. So when you start introducing other tastes, from other food, there's pretty good chance na they have neophobia, so new phobia to new sensation, So yeah, some studies will show na na kids with preference for sweets, So, di ba ang atong commercially prepare kaning mga commercial infant food, are quite sweet, So, uh, they tend to be picky eaters when they become toddlers or when they reach preschool. So again, ang emphasis on variety, So that's why when you introduce food, dapat you introduce them to a lot of types of food, a lot of different tastes, so that when they reach 1 year old, when they'll be eating table food na, so anad na sila, sa ng mga taste. And also the lactating mothers, they have to eat sa kanang variety of foods para siguro ang infant mas anad na or exposed na sa atong mga tastes, different tastes. So that's the
Yeah.
problem in giving complementary kanang commercial food.
Because you somehow sensitize the taste of the child. Okay.
Mura lang siya kanang chicken joy ra gid permi mo ipakaon, so chicken joy na lang. So kung tagaanin mo siya chicken McDo, hindi siya ganan chicken McDo. Okay, chicken joy ra gid siya na anod.
Okay. So in the interest of time, I am sorry, but I have to close the open forum. We have had a lot of questions on the Q&A box. But as Dr. Oliveros said, you can always text him. Now, with your permission, shall we put your number on the chat box?
Pwede. Pero I think they have my numbers naman sa team mo. So
So
the
just in
doctors
case
are
you don't, you can
we
see
have
his
my numbers.
number on the chat box. Okay. So
Sige, chat na ako. Okay. Pero don't give my number to patients ha. Or di ko nila kuliton. Give lang the number of my secretary.
Oh, I'm sorry. All right.
Okay, so
And then, so thank you, Dr. Oliveros, for your patience in answering the questions in the open forum and for your knowledge shared to all of us today. Let me now welcome our Vice President of the chapter, Dr. Maria Therese R. Habay, for the closing remarks. But before that, let me remind all attendees to stay until the end of the closing remarks so that you will see the link to the CPB quiz that you will need to answer so that you will get your certificate. Don't worry, it's just a short quiz. Okay, Dr. Habay.
Okay, good evening, everyone. Tonight, we have witnessed another first in the history of PPS NCM, this being the inaugural online lecture initiated by the chapter. My appreciation and gratitude goes to Dr. John Paul Oliveros, who willingly accepted the invite to be the first lecturer. Congratulations, Jao, for a very informative and relevant lecture. Sa sunod na sada. My heartfelt thanks also goes to Dr. Cindy Llego, our very efficient and organized chapter secretary, for acting as the moderator and IT consultant as well. I would also like to extend my utmost gratitude to my teammates, Dr. Early Sanchez and Dr. Michael Te, for their invaluable help in making this webinar possible. Thank you to Dr. Rowena Kawili. Weng, thank you so much for helping disseminate the information about this webinar. We have a very good attendance. I think there are about 159 attendees, if I'm not mistaken. And then thank you to Natra Farm for their technical assistance and for providing us with this platform. And last but not the least, I thank you all for participating and supporting this endeavor. Be rest assured that the chapter will be doing its very best to come up with more CPD activities despite the limitations brought about by this pandemic. We will keep you posted. In fact, we already have 2 lectures for August. Hoping to see you again in the upcoming lectures. Good night, stay safe, and enjoy the rest of the evening.
Thank you, everyone.
Thank you.
Thank you very much, Dr. Therese Habay, for your closing remarks. If you look
Thank
at the
you,
chat
Cindy.
box now, you will see the link to the CPD quiz. If you click on the link and you answer the 5 questions, you will automatically receive your CPD certificate in your email. So this link will also be made available on our Facebook page for those who will not be able to answer the quiz right now. For questions about the CPD quiz and certificate, as well as feedback and suggestions of future CPD lectures, please email us at ppsncm.cpd2020@gmail.com. Stay safe and keep healthy, everyone.
Good night.
Night.
Good night.